How do hysterectomy types differ for cancer treatment? When it comes to treating cancer, especially cervical cancer, understanding the different types of hysterectomies is crucial. Each type varies in how much tissue is removed, which depends on the cancer's stage, location, and potential to spread. Let's break down the main types of hysterectomies used in cancer treatment. First, we have the simple, or total, hysterectomy. This procedure removes the entire uterus and cervix. It is often used for early-stage cervical cancers that have a low risk of spreading. This type does not involve removing surrounding tissues or lymph nodes, making it less extensive and generally associated with fewer complications compared to more radical surgeries. Next is the modified radical hysterectomy, also known as type Roman II. This surgery removes the uterus, cervix, and the upper part of the vagina. It also involves taking out some connective tissues around the cervix and ligaments that support it. This type is typically used for early-stage cervical cancer with smaller tumors and a lower risk of spread. It tends to have shorter surgery times and less blood loss, which can lead to fewer complications. Then we have the radical hysterectomy, or type triple. This is a more extensive procedure that removes the uterus, cervix, the upper third of the vagina, and a significant amount of surrounding tissue. This type is standard for early-stage cervical cancer that has a higher risk of local spread. While it is effective, it is associated with longer surgery times and a greater risk of complications, such as urinary retention. Finally, there is the extended radical hysterectomy, or type Roman IV. This is similar to the radical hysterectomy but involves removing more tissue, including a larger portion of the vagina. This type is used for more advanced cervical cancers that requiring a wider clearance of tissue. In many cases, a lymphadenectomy, which is the removal of pelvic lymph nodes, is performed alongside the radical hysterectomy types. This helps assess and treat any potential cancer spread. The surgical approach can vary, with options including open abdominal surgery, laparoscopic, or robotic-assisted methods. Minimally invasive techniques are becoming more popular, especially for certain reproductive cancers, due to their benefits like reduced recovery time. Choosing the right type of hysterectomy is a balance between controlling cancer and preserving the patient's quality of life. For low-risk early cervical cancer, a simple hysterectomy may be sufficient. However, for tumors with a higher risk of spread, a radical approach is often necessary. It is essential to remember that treatment decisions should be personalized. Consulting with a multidisciplinary medical team can help ensure the best approach for each individual, optimizing cancer control while minimizing potential side effects. Always seek professional medical advice for the most accurate and tailored treatment options.